And it is focused on the pandemic's impact here in Nevada, including the increase in people enrolled in Medicaid during that time. Boy, has it expanded, but it also costs more than ever. So let's break it down with the help of Rachel O'Brien from OpenTheBooks.com. So, Rachel, I remember years ago when Brian Sandoval, a Republican, was governor of this state, he expanded the Medicaid rules. And back then, we weren't in such a divisive nation. He ended up getting bipartisan support in doing so. But then you put the pandemic into the mix, and I'm wondering, is this sustainable?
Yeah, so the answer is no. So this expansion did come because of the pandemic, and this is all over the country. So specifically in Nevada, the Department of Health and Human Services, they wrote this report. They looked at how the pandemic damaged the state, essentially. It reiterated many things we already knew about the negative impacts of the pandemic that have been reported on this station and around the country. You know, it doesn't come as a surprise that the pandemic cost lots of people their jobs, at least temporarily led to a huge loss of life, an increase in homelessness, substance use, all bad stuff. But it did find an upside that consumers toward the end of the pandemic spent more and helped the economy. That was one good finding, is that people in Nevada spent $18 billion more in services in 2022 than they did in 19, and $16 billion more in goods in 2022 compared to 2019. So that was an upside.
And doesn't this, Rachel, kind of give us an idea, a snapshot of what folks are making or not making enough here in the state? Because, correct me if I'm wrong, Medicaid is for essentially indigent folks to make sure they have their health care needs covered. But there is a threshold as far as how much money you can make to be able to be eligible for a program like this. So if we are just overrun with Medicaid recipients, it seems like these folks aren't making enough money to get their own health care.
So what happened with Medicaid is, and you're right, it's federal government insurance for low-income people who qualify. It's paid for both by the federal government and state governments. Each state government really runs its own Medicaid program. So yes, in 2022, more than a quarter of Nevadans were on Medicaid. And that's a 40% increase from March 2020. So what happened is the federal government expanded qualifications for Medicaid during the pandemic. It was called continuous enrollment. If you enrolled in Medicaid, you were qualified. Even if you went back to work and your income increased and technically you no longer qualified, you would stay enrolled. It was called continuous enrollment during the pandemic. So that's why these huge number, again, a 40% increase, huge number of Nevadans, and this is across the country, this happened, were on Medicaid. And it accounted for a third of state spending. 1/3 of state budget went to paying for this.
Wow.
In 2022, it was $3.6 billion.
My goodness. Well, and think about how many independent contractors we have in this quote-unquote hospitality town. And then during the pandemic, you can see why so many more people were put on those rolls. Before we let you go, is there any other state that compares to us, or are we pretty unique in nature?
No, so I mean, all states saw an increase in Medicaid spending. They did get a little bit of help from the federal government. That's why they expanded coverage. The government said, if you expand your coverage and let all these people coverage, will give you a little bit more money, but it doesn't pay for everything. All states did this. It just ended this spring. It just ended at the end of March. And so people really did get and are continuing to get kicked off of it. One big thing with Medicaid, it is the number one. It's tied with Medicare for the top cause of improper payments. People getting the wrong payments, the wrong people getting money they shouldn't. $50 billion worth last year. So this will free up a lot of money for the state now. If they're no longer paying this, you're talking about funding schools or giving more money to the underfunded pension system. It can really be used elsewhere now.
The fleecing of America when there is Medicaid fraud. But from what I understand, you want folks who can't afford to go to UMC, our county-run hospital, to have some coverage. Otherwise, we are, as taxpayers, paying at the highest rate possible. So this is quite the quandary. Thank you for taking us through where we are in 2024. Rachel O'Brien from Open the Books. Have a great weekend. We will see you again next week.